Hello my dear pharmacist friends, welcome to this new pharmacy video. In this video we are going to discuss 8 important aspects of drugs that a pharmacist should know. Well, there are many other aspects also, but these 8 are the most important that a professional pharmacist must know, because it is only through this knowledge that a pharmacist can exercise his expertise in the healthcare field. Without further delay, let's start. The first important aspect of any drug is its generic name. It's actually the most important and significant name of any drug. There are other names also for a certain drug, like its proprietary name or brand name and chemical name. The chemical names are mostly used in the literature, while the proprietary or brand name is given by a specific manufacturer. It is the generic name that is widely recognized across the world for a certain drug, and it is also recommended for doctors to prescribe their medicines with generic names, as this name can be widely and easily recognized by healthcare professionals and others. As an example, we can take aspirin. It is the generic name for this drug. Its chemical name will be acetyl salicylic acid, while its brand name is Disprin. The second important aspect of any drug is its pharmacological class. That is its place in the pharmaceutical classification of drugs. As an example, we can take aspirin. Its pharmaceutical or pharmacological class is NSAID, that is non-steroidal anti-inflammatory drug. Also, another medicine, loperamide, its pharmacological class is antidiarrheal, for it is used in the treatment of diarrhea. And another example, dimenhydrinate. Its pharmacological class is antihistamine. It will block the H1 histamine receptors and try to kill allergy reactions. So it is important that a pharmacist knows the pharmacological class of a certain drug or any drug. Our third important aspect of a drug is its mechanism of action, meaning how it exerts its action inside our bodies. Mechanism of action simply means how a drug achieves its pharmacodynamics in our bodies. The examples for a mechanism of action will be like methotrexate. It exerts its action via inhibition of the enzyme dihydrofolate reductase, and thus it will prevent the formation of tetrahydrofolic acid. Actually, folate is a B vitamin and it is required in many biochemical functions. When folate is antagonized, meaning its synthesis is inhibited, then further of its biochemical reactions will not take place, like cytokines production, which are immune cells and that are involved in the immune reactions. Methotrexate works as immunosuppressant agent and also as anti-inflammatory agent. By suppressing the immune system, inflammatory reactions are also tackled. Another example, amphotericin B, an antifungal agent that acts via binding to ergosterol in the plasma membrane of fungal cells. By interacting with ergosterol, amphotericin causes pores in the membrane, thus disrupting its function, leading to electrolytes and other biomolecules loss and resulting in cell death. So fungus dies as a result of this mechanism of action. The fourth important aspect of a drug is its metabolism and elimination. That is how the drug is metabolized in our bodies and also through which route it is eliminated. That is via urine or through feces. Also, knowledge of metabolism of a drug is important, because if a drug is metabolized by a certain liver enzyme, that is cytochrome P450, it's any isozyme form, then it can have interaction with other drugs that are metabolized by the same enzyme. Our fifth important aspect of a drug is its indications, meaning in what conditions this drug is usually prescribed, or the medical situations in which this drug can be given. Examples for indications will be in allergy situations like itching or other skin conditions, antihistamines are given. Likewise, for bacterial infections, various antibiotics are there which are indicated for their treatment. Likewise, if we have worms in our stomach, then for that anthelmintic medications are prescribed or indicated. The sixth important aspect of a drug is its common side effects are adverse effects. Actually, there can be many side effects of a drug, but it is important for a pharmacist to at least remember the common side effects of drugs. For example, we have ACE inhibitors, that is angiotensin converting enzyme inhibitors, that are antihypertensive agents, and their common adverse effect is cough. Likewise, we have opioids, their common side effect is constipation. Also, to know about the adverse effects of drugs is also important. For example, we have doxorubicin, anti-cancer drug, and its adverse effect is myocardial toxicity. So, as a professional pharmacist, one should be aware of these side effects and adverse effects. The next important aspect of a drug is its interactions. Well, we must be aware of the interaction of the pharmaceutical agents with other pharmaceutical agents. That will be drug-drug interactions. Also, as a pharmacist, we have to be aware of the drug-food interactions and drug-disease interactions. All these are important because without this we can have fatal consequences for the patient. So knowledge of this is very important. The example for drug-drug interaction will be if a patient is on isosorbide mononitrate, which is a coronary vasodilator drug used in chest pain and other conditions. In such a patient, sildenafil will not be recommended for the purpose of erectile dysfunction. So these two drugs, isosorbide mononitrate and sildenafil, should not be administered in combination because they will have the drastic adverse effect of severe hypotension, which can lead to many complications. The example for drug-food interaction will be that is in the presence of food, some drug will absorb effectively while others absorption will be hindered. For this reason, some drugs are recommended to be taken on empty stomach while others with food. If the pharmacist is aware of drug-food interaction, then he will be alert enough to advise the patient about how to take this drug. For example, some drugs are recommended to be taken on empty stomach, like omeprazole. They are advised to be taken on empty stomach in the morning at least 30 minutes before breakfast. Other drugs are there that are recommended to be taken with food, like NSAIDs. NSAIDs have gastrointestinal side effects which can cause dyspepsia, bleeding, and gastric ulceration. To reduce these side effects, it is advised to take NSAIDs with food. Example for drug-disease interaction will be in patients in which cardiovascular disease is established. In such patients, NSAIDs are usually not recommended except for aspirin because these other NSAIDs will increase the risk of cardiovascular events more. For this reason, in cardiovascular patients, NSAIDs except aspirin should not be given, for they may exacerbate their condition. So this was our 7th important aspect of a drug. Our last important aspect of a drug that a pharmacist should know is its pregnancy category. That is, its use in pregnancy. A pharmacist should know whether a certain drug is safe in pregnancy or not. We have 5 categories of pregnancy. Pregnancy category A, category B, C, D, and X. Actually, the pregnancy category A drugs are the safest of all drugs, while category X drugs are absolutely contraindicated in pregnancy. While the in-between, that is category B, C, and D, these drugs are prescribed according to the risk-benefit ratio. Example of category A drugs is multivitamins, thyroxine, etc. Example of category B drug will be paracetamol, erythromycin, etc. Category C drugs example will be morphine. Category D drugs examples will be anti-epileptics, and category X drug example will be thalidomide. So knowledge about the pregnancy use of a certain drug is important for pharmacists. Now to summarize the 8 important aspects of drugs that a pharmacist should know. Our first important aspect of any drug was generic name. The second aspect was pharmacological class or group. The third one was mechanism of action. Fourth one, metabolism and elimination. Fifth one, indications. The sixth one, common side effects or adverse effects. Then the seventh one is interactions, which includes drug-drug interactions, drug-food interactions, and drug-disease interactions. And the last one is pregnancy category, that is use in pregnancy. So friends, these were the 8 important aspects of drugs that any medical healthcare professional, especially pharmacist, should know about. Thanks for watching.